In any event, we're going to shoot right into healthy vending. So I'm really excited to announce Gina Deluca. She's the Worksite Wellness Coordinator at the Rhode Island Department of Public Health, our fabulous neighbor state of Rhode Island. We're all doing great work in this area, and Rhode Island's a perfect example of that. She's going to talk to us about implementing and what they've done through the state with healthy vending in general, which is something you can do at your work site. So hopefully this will give you some new ideas and also educate you a little bit about healthier options in vending machines. So take it away, G.
Thank you, Angie. So as Angie said, I'm Gina Deluca. I am the Worksite Wellness Coordinator at the Rhode Island Department of Health. So I'm going to talk to you a little bit about some of our healthy vending and nutrition policies that we have currently that we're working on right now. Going to keep it brief. I know it's the end of the conference and everyone's probably, after being outside, you want to get back out there. So not that I'm rushing to get back to my desk, but I have a nice 30-minute drive back, so I can get some fresh air with the windows open. So I'm looking forward to that. So the goal of our program is to increase the sales of healthy food and beverages sold on state property. So the Worksite Wellness Program is part of the Physical Activity and Nutrition Program, which is a part of the Center for Health Promotion at the Department of Health. And we were given grant funding from the CDC to work on this initiative. So we have a 5-year grant that we're in the year 3 of this project. And we focus on 3 areas, vending machines, cafeterias, and then also meetings and events that are sponsored by the health department. So how many of you have a cafeteria or cafe, some type of snack shop or something at your work site? How about vending machines? Yeah. And how many of your work sites sponsor meetings or events where food and beverages are served?
Oh, yeah.
Yeah. So hopefully, you'll be able to take some of this information back and relate it to your work site as well. So the first area I'm going to focus on is the vending and cafes on state property. So have any of you ever heard of the Randolph Shepherd Act?
I have.
Yeah.
And Nancy
Oh, yeah,
from
we
the
have.
Y,
That's
Nancy
right.
Wine Vendors.
Do you work with them at the Y?
Through Voices, though, we try
Well,
to-
Voices, yeah, but we yeah.
What is Voices?
Voices for a Healthy Southcoast, it's a local coalition. We try to implement some form of healthy vending, and we had to go through and learn this act and how they have precedence over this industry. And we didn't get very far.
It's interesting, isn't
We
it?
didn't get very far, right?
We didn't get very
thank you.
far, but we tried.
Yeah. So it's a national law which states that persons who are blind are provided employment and self-support through the operation of vending facilities on federal and other property. So basically, any vending machines on state property and also small cafes or snack shops, the Blind Vendor Association, they have first dibs to own one of these stores or these vending machines before it's even given out to the public. So in Rhode Island, like I said, it's a national law. So in Rhode Island, we have, I want to say maybe like 15 or so state buildings that have snack shops. It's kind of like a little convenience type store. Some of them have grills where they can make sandwiches and things like that. Others just have, it's like a glorified vending machine with chips and candy and soda and a lot of junk. So the blind vendors that run the concessions or cafes also own vending machines in that particular building that their snack shop is housed in. So something to keep in mind is this vendor pretty much owns the store. They can run it however they want. They can buy and sell whatever they want. And this is how they make their money to pay their bills, to pay their mortgage, to buy their meals. I mean, this is their livelihood. So they are super protective over how we try to control their business. And as you can imagine, it makes it very difficult to make any types of changes. So just touching on some past experiences, before I was a part of the physical activity and nutrition program, Worksite Wellness used to be housed with environmental health at the health department, so it was with the OSHA program, which is Worksite Safety, and then as a result of this grant, then I got moved to the physical activity and nutrition program, which makes a little bit more sense, and it's a lot easier for me to coordinate because with that team there's tobacco cessation, violence and injury prevention, mental health. So it's more of a wellness related team. So prior to me joining the team, they did a huge sugar-sweetened beverage campaign. So I don't know if they did radio ads, billboards, bus wraps, just basically trying to get rid of sugar-sweetened beverages, making people aware that, you know, a 20-ounce bottle of soda, when you visualize how many spoonfuls of sugar are actually in that, trying to get kids to be aware of that and what you're serving your kids. So as a result of that campaign, the previous administration and some folks on our team decided to tackle the vending machines on state property, specifically in the health department building, because it's on the first floor. It's open to the public, so there are people coming in to get licenses, birth certificates, all sorts of things on a daily basis. So it's kind of embarrassing to have chips, soda, chocolate, all of that in your vending machine right open for the public when we're preaching to businesses and schools and municipalities, hey, why do you have that in your vending machine? Get it out, it's not good for you. But come to our building because you can get it there. So they started out with the vending machines. And the way they went about it, I think kind of, they wanted everything out all at once. There was no 50-50, 60-40 of healthy, non-healthy items. And as you can imagine, they were met with a lot of resistance from the blind vendors who owned those particular vending machines. They said, you know, this isn't fair, this is how we make our money. So they started out and they had a very rough relationship. As time trickled on, staff changed, funding changed, and the project, the major sugar-sweetened beverage campaign was over, and this project kind of fell to the wayside. So most recently, like I said, with this new grant, we kind of picked it up again. So they said, Gina, now that they hate us, it's your turn to go in there and try and convince them to serve healthy food. So I really tried to do a lot of research, talked with other states to see what they were doing. The CDC had all of the people who were funded by the same grant to down in Atlanta to meet and talk about some barriers and some struggles and just different goals and objectives of the grant. So I was down there, and this was like one of my favorite parts of the whole conference. We had little breakout sessions at tables, and one of the tables was just talking about barriers and issues that you've had with your grant. And you know, people were going around the circle saying things, and I said, have any of you had any issues with the blind vendors in your state? And everyone just let out a collective sigh, and they said, oh, you have no idea. So it made me feel good knowing that it wasn't just our state and it was everywhere that people were having issues. And I'm the kind of person that I get a task and I like to hit the ground running and get it done like yesterday. And having them tell me, yeah, it took us like 4 years to even get them to get rid of, you know, half of their unhealthy products, or we're still working on it and don't worry about it, it's a long process. So that made me feel better. So I started out talking with their supervisor at the Department of Human Services. So the woman that I got in contact with, she oversees all of the blind vendors. And I'm lucky that she is on board with the initiatives that we want to implement, and she's supportive of it. So that certainly helps because she can influence the Blind Vendor Association. So first what we did was we wrote a letter of introduction, just saying, you know, hi, I'm Gina, I'm from the health department. You're going to be seeing me probably a lot around your facility. I want to get to know you, build a relationship with you. We have money to help you implement some of these activities. I know things probably didn't start off very well a few years ago, but you know, we kind of want to repair that relationship and work together to implement some of these projects. So And then I went to every site and had a face-to-face meeting with them. And there's about, like I said, there's about 15 different cafes, and like 11 of them are currently staffed right now. So like some people are trading places, some just are in a building that's not used frequently, so they shut it down. So there's about 11 different sites that I had to go to. Based on that, I will say that most people were, I was nervous because I hadn't heard good things, but most people were very receptive, and they said, you know, we're willing to work with you as long as you can provide us with resources and you can help us. Because last time it was kind of just like, here, this is what you need to do, but we don't have the staff to help you, so figure it out on your own. And that's kind of what really upset them. So I said, yeah, you know, we have the staff now, we have the money to do this, and, you know, hopefully we can work together on that. So then I went to each site and conducted baseline assessments of both the stores and the vending machines. Just how many rows of sugar-sweetened beverages do you have? How many rows of water do you have in your vending machine? What kind of chips are you selling? What's the portion sizes? What are the prices? Where are they placed? So we just kind of did a visual, kind of quick, just checking things off in a chart assessment. And just to give us an idea of what people are selling. Then we also did a staff survey, anonymous, to all health department employees. We didn't want to do it to all state employees. We just kind of wanted to pilot some projects at the health department before opening it up to everybody. So we surveyed our staff, and it was more of a general wellness survey, but we did focus a lot on nutrition and physical activity. So we asked them questions like, how often do you buy things from the vending machine, or it's called Coffee Plus, that's the name of all the shops. So how often do you buy things from the vending machines and Coffee Plus? If you do or do not, why or why not? What do you normally purchase? What are some things that you would like to see there, just to get an idea from people. And we also wanted to use that to kind of reinforce what we are pushing on the vendors, to say there is a need for this, people are interested, and just to kind of get some feedback. So then I did one-on-one interviews with all of the vendors. Just to, you know, we want to hear why or why not, how they pick what they're serving and selling, how their businesses are run. And the interviews were the most interesting part of this project to me, because it helped me to see that all these stores are run completely separately. There's no rhyme or reason how they do things. This one does inventory once a year. That's not a joke. And this one does inventory once a month. I think that was probably the most people had done inventory. How do you determine what products you're going to sell? Oh, I look on the shelf and see which one is empty, and that's what I order next. I mean, it was very basic level, like no business training or anything like that. So it kind of helped me to see where they were coming from. And there were a lot of barriers for them. So a couple of them included, they're very small stores, so they don't necessarily need to buy things in bulk. So they were having trouble finding a distributor who would deliver products to their particular site and for such a small quantity on a weekly basis. Also the availability of products. I had gotten some product lists from different distributors, and there were maybe 2 or 3 healthy things on there that the blind vendor could pick from to serve. So they really aren't given much choices in things. They also felt like there wasn't enough marketing done to employees or the public of the building that they were housed in. And, you know, a lot of them, I don't know if I said this before, but they all have varying levels of their disability. So some of them, they're all legally blind, but some of them can drive, and, you know, they can function, they're high functioning. Others can only see like a shadow. And like the store at the Department of Administration, the owner there, you have to say, I have a bottle of water and I'm giving you a $5 bill. Like that's how intense his disability is. So they're all very different. They're all run very differently. So also some of the things that they said they had problems with were storage, lack of storage, and they're not super busy. So for them to buy fresh produce, and also this goes back to their inventory or lack of inventory, they might not sell it before it goes bad and expires. So they end up throwing things away, and they really can't afford to do that. So we then worked with the American Heart Association, the Rhode Island chapter. At the time, they were focusing on the geographic location of Providence, and we have a lot of stores in the Providence area. So they were great because we worked with them on doing a taste testing in our building for some healthy items. So at the time I had an intern from Johnson & Wales who worked with Bob, who is the store owner for Coffee Plus in our building, and he owns the vending machines. And he just kind of said, he looked at the menu and said, these are all the things that you already have. Let's kind of just create something different. So he already served grilled chicken, and he would put it on a salad. So we said, why don't you try and make like a wrap out of it? Or, throw some veggies on there and get a can of black beans, and we made like a Tex-Mex wrap. All healthy, chicken, lettuce, tomato, beans, and avocado. So we just tried to be creative, and also we did a taste testing with that and some Kind bars and different things that could go in a vending machine. And they all had to kind of pass our health department guidelines on what we would consider to be healthy. So we did the taste testing, which people really loved. You bring food, everybody will show up, especially if it's for free. So, and we also did a survey at the taste testing, asking people if this is something that they would purchase, if it was available, did they like the appearance of it, what about the price point, and different things like that. So that proved to be very helpful. However, nothing ever came from it. Our vendor is not necessarily the most motivated to change, so even showing him the results of the assessments and the surveys, he said, no, people aren't going to buy it, I'm not going to make it. And it's tough because we can't force him to do anything. All we can do is provide him with our recommendations. So this is where my frustration comes in, because we do all these initiatives, and at the end of the day, it's his choice if he makes that change or not. So in the future, we're now looking at a couple different routes. Has anybody ever heard of the NEMS assessment? It's the Nutrition Environment Measure Survey, and they have one for vending machines. So basically you plug into the computer the name of the product, whether it's food or beverage, the size, and it comes up as a red, yellow, or green food, which shows you green is okay to eat, yellow you should eat in moderation, and red you should really try and stay away from. So my intern put all the assessments into this NEMS program so we could see, we could really say, this is a certified assessment. This is showing you that 75% of your vending machine is red food. Just to kind of make it relatable to them. So we haven't shared those official assessments with them yet, but that is something that we plan to do. We're also working with our communications team at the health department to do some labeling for the menus and the products. So just to kind of help the consumer know, I don't want to have to pick up these 2 bags and look at the nutrition labels and see, well, this one has a little bit more sodium and this one has more sugar, which one's better? They're going to be, it's like a little, what we think is going to be kind of like a little green check mark, just saying like this is a health department approved healthy snack, takes the guessing game out of it for you. And I also think it will help for the vendors to see, wow, there's not a lot of green checks in my store, so maybe I should try and offer some more healthy things. Because I did see in the interviews that what people think is healthy really is not. So, they say, well, these are baked chips, or this is nuts. Yeah, but they're buffalo chicken flavored nuts. I mean, it's not, how much salt is on them, and it's just, maybe it's a better choice than the ice cream sandwich in the cooler, but it's still not a great choice. They expressed interest in doing that just to share ideas, what's working in your store, what's working in yours, and just to be able to collaborate a little bit better on that. And then we're also talking with our director on a possible executive order from the governor, coming straight down from the top saying, this is what we're looking to implement is on a scale. So, yet for right now, you need to have 20% of your vending machine be healthy products, and another 6 months it's going to be 50%, and another year it's going to be 75%. Because we understand this is how they make their money, but at the same time, it's costing the state money. We're self-insured, and so all this money that we're spending on healthcare costs, obesity-related illnesses and diseases, chronic conditions, at the end of the day, it's really a positive for everyone. And the reason we didn't really want to go the route of the executive order, we wanted to take baby steps with them and work with them. But based on feedback from the CDC and a lot of other states, they said that was really the only way that they were able to implement any changes. So we feel like I can go in there and tell them something, but who am I? I have no authority over them. So if it's coming down from the top, and it's also going to be a blanket over anything sold on state property, whether it's a blind vendor or not. So that's good for them because they were concerned about competition with the cafeteria sites and other things. There's some private companies that own cafes and things on state property. So if it's everything sold, I think that would ease them into it a little bit better. So another issue, and this is a positive for us, our campus at the Department of Health has our building, Department of Transportation, and the Department of Administration. And then across from that is the State House. So we kind of are called the Capitol Hill campus. So the Department of Administration houses the cafeteria. So they've got the salad bar, the grill, the hot and cold sandwiches, they have everything in there. So anyone in one of those 4 buildings goes to that cafeteria because otherwise it's just vending. So the contract was up for the current vendor in that cafeteria, and we got new administration with the new governor. We got new directors of both the health department and the Department of Administration, who are both super supportive of health and wellness and worksite wellness, which is great for us. And they said, why are we selling a piece of Boston cream pie at the register in our cafeteria? Why is all this candy up front? And if you want to sell it, that's okay for now, but why isn't it in the back? And there's just a lot of things going on that really are not best practices. And like I said, it's kind of embarrassing as the health department, housing that. So the Department of Administration included myself and our food systems coordinator in writing the new contract language for the RFP, the request for proposal that's going out to the new vendor, which was really, really nice of them because they didn't have to include us in that. But we were able to write into that contract some nutrition standards, which include portion sizes, the limitations of trans fat, sodium, and sugar. And also we included in there a partnership with myself and a wellness team. So whoever comes on board as this new vendor will have to work with us. So it's nice because it will start off in the beginning of the relationship, where the current vendor's been there for a couple years. So to get them to change their ways, it would be kind of difficult. But starting right in the beginning is great. So we really want to work with them on product placement, like I just said, offering at least one healthy menu item per day or a special. They do 3 or 4 specials a day, so at least one of them be a health department certified healthy meal or snack. And then also posting nutritional information at the point of sale, just like I said, to make it a little easier for the consumer to do that. So that contract proposal is currently posted, and we've had people bidding on that, and that process will go on for another month or so probably. So by the end of the summer, we should have a new vendor in there, and we'll be able to start working with them on a lot of these initiatives, which is exciting because that's really the only way that we're going to be able to make any changes there. And then finally, I just want to talk about the healthy meeting policy that we've developed at the health department. It can be viewed at the website here. It's just a one-pager. It was developed for the purpose of providing healthy options when hosting a meeting or event. So any health department sponsored meeting, conference, public event, anything, whoever is serving or deciding what to serve for the meals, they have to obtain by the guidelines in the healthy meeting policy. So just to give you an example, it talks about having water available through the event, offering low-fat or fat-free options for the milk and the coffees instead of, the cream. Limiting the beverages with artificial sweeteners. For the meals, try and choose local, don't serve any fried foods, provide fruits and vegetables as sides, whole grains, talking about single serving portions. So it's just kind of a guideline for people to go by. And it's great because we've had a couple local vendors come on to adopt the policy. So the Providence Marriott, if you are looking to book a meeting there and you call and say, I'm booking a meeting, 50 people, let's say, and I want to serve a healthy meal. And normally the conference center would give you the list of their entire menu, and then you'd have to pick from there what you think is healthy. And who knows if the person booking the meeting even has any background in that. But now, if you go to the Marriott, you can say, I want a healthy menu, and we have a set menu with set items that the health department has approved and said is healthy. So it takes the guessing game out of it for those people who are booking the meetings. And we've had quite a few different events there, and they've done an amazing job for us. Everything, it's a very similar spread to today, but, taking out a few things here and there, but everything on the whole spread is approved and healthy, so that helps as well. And it also goes for any of our contracted partners, so anyone that we provide funding to. If we provided funding to the Y, let's say, and with that funding they are hosting a different class or a meeting, they have to provide healthy food for that meeting if they're using our funding. So, so far, it's hard. People have adopted it, but it's hard to enforce it. It's obviously not a law. There's no way you can be punished if you don't follow the guidelines. But it is something we recommend, and people have taken advantage of it, which is nice to know. And like I said, it can be viewed at our website. You can just go to the health department site and Google the healthy meeting policy, and that will come up. I do think we might be making some changes to it in the future, but it at least helps to give you, if you wanted to create a similar policy at your site, it's a nice outline for you to have on that. And I think that's all I have for you. Does anybody have questions, or Angie?
I just wanted to say, Gina represents obviously Department of Health, it's a government organization. A lot of us are at work sites where we don't have to jump through these hoops, right?
Right.
So
I envy all of you.
Yeah. So it's probably easier to implement a healthy vending policy at your work site. I have one already written up. All you have to do is fill the blanks. So I've done the work for you. A lot of the wheel has been invented. Don't go back to your work site and feel like you have to now go through, trials and tribulations to get a healthy vending policy. That's a small policy change that can happen. It's an environmental piece that's really important. And like she said, you don't have to get rid of all of the unhealthy options at first. You can just move them. It's all about product placement. Mm-hmm. Or offer the healthier option being the easier option. The reason we learned about those wide vendors too was because we were trying to get healthier foods in the snack houses in the after-school programs. Your baseball parks and your soccer games and
Do they run those as well?
I believe most of them did. I can't remember. This is going back about 2 years. I don't know if Nancy remembers. But needless to say, they sell junk at baseball games and football games. And so there's that limitation. But again, a lot of you are coming from private work sites. You're on limited budgets. So know that I am a resource for that. The collaborative itself is a resource for that. So,
and I definitely think making that change on a scale and not taking everything out at once is the way to go. You don't want to really shock people, and you really get people mad if you do that. But if you fade things out slowly, it's all about creating a different culture and the culture of wellness amongst everybody and kind of making a new norm.
I was struck by what Angie said about making the healthy choice the easier choice, and I think one way to do that, speaking for myself, is to make the healthy choice a little bit cheaper than the other stuff. I mean, that stuff in vending machines is outrageously priced anyway, and you know, so if you took a quarter off something. I know it's hard to do, you have to juggle what you have to pay them, and they, you know, all that kind of stuff about vendors, but it can make a difference. And I also wanted to just say, you know, I worked at the health department when all that happened, and you can't imagine if it was like the vending wars. And the vending machine downstairs in the basement was pretty much just employee use. The big vending machine up in the lobby was public, and it was right next to where people went to get their birth certificates, their marriage certificates, their death certificates. So people used
There's a
to
constant line.
a constant line, and they'd have 5 or 6 children with them, and the children would see the vending machines and say, can I, may I? And then they consume the sugar because they were waiting there forever, and then run around screaming. And then what happened was, I had great empathy for the poor person who worked, and so he was okay if you took the employee. He was a little upset, but not too bad that you took the employee one and cleaned it up. But he made good money on the one upstairs because of the kid factor. So that was what happened was, not only did the kid factor one win and stay unhealthy, all the health department employees started running upstairs. So it was a wild thing. And the thing about the blind vendors, and I won't take too much time, but I don't know if you notice how much when you even talk, they say they looked at the shelves, they looked at this, they looked at that. They don't really look, they feel. And some of the barriers, you know, the barrier that's really hard there, and I pray always that it gets better, is people steal from them. Oh, people steal from them all the time.
That's terrible.
Yeah, they'll tell them it's a $5 bill and it's a $1 bill, or they'll grab the stuff in the back and walk out.
Yeah.
Nice people, you know. Usually the public, not the employees.
Right, yeah, the public, that's the
public,
issue.
yes.
Yeah, because the employees really do build a relationship, you know, they're going down to
Yes,
get their
they do.
coffee every
Yes,
day,
they do. Yes, they
hey
do.
Bob, how you doing? And so they, you know.
It helps to understand that they have stress, and they're not included in anybody's worksite wellness program.
Exactly.
Right.
You know, they have wicked stressors.
Oh yeah, for sure.
So anyway, that was really good.
Thank you. Does anyone have any other questions?
Thank you.
All right, thank you.